Good morning, everyone, and greetings from Columbus, Ohio. My name is Brittany Sandage, and I'm here at the Drug-Free Action Alliance headquarters. With me today, of course, is Tony Coder, our Director of Advocacy and Public Policy. There's quite a number of things to cover at the federal and state level today, so without any further ado, I will kick it over to Tony. Just as a brief housekeeping rule and a reminder, 3 hours after your scheduled broadcast today, you will receive your RCH certificates or certificates of attendance. If you are having problems receiving those, please just let either Tony or myself know, and we'll help you at the end of the broadcast. Thank you so much. Tony, it's all yours.
Thank you so much, Brittany. I titled this the Advocacy Webinar, the Money Edition, because we're going to be talking a lot about budgets, both at the federal and state level. Some big news I'm sure most of you have heard about, but wanted to go into a little bit more. The federal budget. I guess late last week, Rich Baum, who is the interim director of ONDCP, the Office of National Drug Control Policy, sent an email to his staff that basically read that the OMB budget that they were thinking about doing. This is not in the president's budget, but this is something that OMB has identified as potential cuts in the budget. I know that the new administration does not want to raise taxes and wants to increase military spending by quite a bit, and that will fall on the backs of different programs. One of these programs they talked about was ONDCP. OMB said that they would give a 95%, the ONDCP would have to take a 95% cut starting fiscal year 18, which is actually this coming October 1 when that would start. A 95% cut would mean that it would eliminate the DFC program, which there are some coalitions currently receiving funding of up to $125,000 for, and also the HIDA program. It would cut staff in half. Quite frankly, I don't know what they would do at that point with those two huge programs. I know they focus a lot on diversion and border controls and all of that type of stuff, and I'm guessing that's what the remaining 30-some staff would do. The OMB said that the Trump administration came back with a statement that said that not only did they this was a preliminary document, something that had not been decided upon. No final decision had been made. However, they did state in the press conference that they think that drugs and mental health funding should be a state and local issue and not a federal issue, which would be great if there was any state funding for this. And I'm not laughing because I think it's funny. I'm laughing because it's ludicrous. So what does this mean for us as those who are working in this field? Well, right now there are 698 DFC grantees in fiscal year 16 across the country. Those would disappear starting October 1 if they didn't find alternative sources of funding. The DFC program would be eliminated. CADCA, I know, has a big agreement to train with evidence-based approaches these DFC grantees. This could be a 10-year grant cycle. 5 years and then you have to reapply. But that's a huge amount of money and a huge loss for communities across the country, not only in Ohio but across the country. This is $95 million is going to 2,000 community groups. These are outside of DFCs. So there's other community group funding for drug and alcohol issues to reduce drug use. Right now we're in the midst of the opiate epidemic, and from some of the things we're hearing from Capitol Hill is that he wants this new committee that he has put together that is led up by Governor Chris Christie that focuses solely on opiates to almost take the place of ONDCP. It DFC recognizes that the drug issue must be dealt with in every hometown in America. This is where a lot of local funding comes from. Again, I know this is a big deal for a lot of us out there. It provides the funding necessary for communities to identify and respond to local drug and alcohol use problems. This is, quite frankly, I try to be nice, but this is devastating, to say the least, to a lot of communities. And I know I'm being recorded, or else I would say this is very short-sighted on the part of the administration. Whoops, I said it. Also, the HIDA program. HIDA stands for the High Intensity Drug Trafficking Area. A lot of us know. There are currently 28 HIDAs in the United States. 18. So in counties across the state, about 1 in 5 counties, 18%, a little less than 1 in 5 counties in the United States have a HIDA program. What they do, which covers about 66% of the U.S. population. So about 2/3 of the population, don't even know it probably, but they rely on the HIDA program to protect their communities, to help coordinate local law enforcement with state law enforcement and federal agents to bring down big drug traffickers. This is supposed to be a administration, and I don't mean to be too hard on this administration, but this is talking about law enforcement and making our streets safe again. This absolutely does not. This creates more of an opportunity for organized crime to move in, less local collaboration with state and federal entities that work on this. So it really is, again, quite troubling. The HIDAs, one of the big things that we know the HIDA for is the Rocky Mountain HIDA. When you look at all of the information that we're getting out of Colorado about marijuana legalization in that state, Washington is starting to, trying to do the same thing, having their own Washington HIDA report. Just basically taking all of this aggregate data and putting into one document so that others across the country can see the impacts of legalization. That would all disappear. Having those coordinating efforts in our communities, in our states, in our country is absolutely key to make, if there's one thing I know about government is we don't talk to each other. The feds really don't talk to the states. The states don't talk to local. When I was at the state, the last thing we ever relied on was local input for some of the issues that we would try to bring rules upon or try to bring legislation upon. So the HIDAs are great at coordinating all of those efforts and making sure that everybody is looped in. All of the law enforcement can be working together on an issue so that local law enforcement is not doing something that really is flying in the face of what the feds are trying to do. I mean, it's very, very short-sighted. I hope there's a bigger plan. But this is where this is where ONDCP is right now. ONDCP, I think their website again was taken down for a time. The director of ONDCP, Romano, the gentleman who had been nominated, he withdrew his name from nomination, so he is no longer, he is taking his name out of consideration for that role. It seems to be quite a mess right now in the drug world at the federal level. The best thing, what can we do? So I'm giving you all this terrible news. We absolutely need to be with, I do give it to both of our senators, Senator Sherrod Brown and Senator Rob Portman, who have both stepped up, said this is a terrible idea. We need this entity at the federal level to help coordinate efforts. We need these local community groups to actually be working on the ground on these types of issues. So I really do lift up our two senators, one Republican, one Democrat. I don't care which side of the aisle you're on. Both of these gentlemen stepped up, and we're certainly appreciative of that. The Democrat Party did write a letter yesterday that did support that we should be reinstating ONDCP. This should not be something that we need to cut. However, in the same letter, they also said, and also leave your hands off marijuana legalization. We should let that happen. So it's kind of a two-edged sword, that letter was. But this is where we need to be active with our congresspersons, with our elected officials at the federal level, state. Our state elected officials really don't have any say in this. So to bother them with it would not be a good use of your time. However, your congressperson, your United States senator, we're probably even, it's Sam, we're probably even going to ask that folks start calling the President of the United States office to try to reinstate and voice our displeasure with this proposed document. So we will have more on that. But right now, if I were in the shoes out in the communities, I think we need to gather every sector that we have to write to our congressperson and say this is a terrible idea, especially in the midst of what we're going through with this drug epidemic we have right now. So moving on, there is also the state budget that we're taking up right now. The House, the Ohio House, again, it's the state of Ohio. This is not a federal budget bill. The state of Ohio passed. The House of the state of Ohio passed the budget, and so now it goes on to the Senate. There were some amendments added that were that were a little bit made you scratch your head, but others, there was another one that was quite interesting. Amendments added: the alcoholic ice cream bill, which I think was House Bill 23, was actually added into the budget bill, even though it has nothing to do with budget matters. It was added into the budget bill as an amendment to have alcoholic ice cream be legal up to 6% by volume in the state of Ohio. We think this is a terrible public health policy, and also think it's kind of sneaky to put it in a budget bill instead of offering debate on this issue. And when you have a public health policy, this is where it's problematic. When you have these huge bills, whether it be the budget bill or the biennium bill. It really, the corrections bill, these are types of issues that need debated. And to take the debate out of putting a product on our store shelves, in our ice cream shops that have alcohol and ice cream, you're talking about really marketing to kids. You're talking about public health issues. An alcohol issue that is what about servers who are serving folks? We have server training for bartenders and those who are selling alcohol in gas stations and in convenience stores. Are we going to have another serving training for Jenny's Ice Cream or Grater's, or even Dairy Queen at this point? So I mean, it really is just a crazy thing, and this is something that you call your local representative, your state representative, or actually your state senator. It's past the House now. So call your state senator and say, you know what, we don't need this. If we're going to have this type of bill, let's debate it. That's the perfect way of handling this, is that we need debate on this. Why are we just putting this in without any kind of debate, any kind of voice from public health, from medical professionals, from law enforcement? We're instead just going to put this in a budget bill and let it pass without any kind of debate. Foolish way of thinking. We also have another amendment that was put in was about doctors who recommend marijuana in the state. Currently, rules say that to recommend marijuana, a doctor will have to when recommending, they will have to give the patient the benefits and the potential health complications due to using marijuana. Any kind of health issues that you may have, that it is a product that has effects on the brain and possibly the heart and many other parts of the body. So the OSMA, the Ohio State Medical Association, didn't like this very much because it put their doctor at risk. I mean, quite frankly, if I were a good lobbying group, I would do the same thing. You don't want to put your, the people that you serve at risk. So they decided to have that stricken from the they had decided to have the law changed. So what the law would say is that yes, doctors would be able to recommend marijuana. However, they wouldn't have to tell the patient about any kind of benefits or risks of using marijuana. Totally lets them off for any kind of negligence or malpractice or anything like that, since they wouldn't have to share any of those types of issues with the patient. Now, if I go into a doctor's office, any other medication, any kind of problem that I'm having, whether it be with back problem or, I break a leg or whatever, and they give me medication, or they give me some kind of, physical therapy routine, they're going to tell me what the benefits, what the risks are. This might do this, this might do that, and this is why are we working outside of the scope of medicine? If we rely on our doctors to tell us the benefits and the risks of medicine, of any kind of recommendation that they are making, then they should also be strong enough in their belief that this is a good product to tell you what the benefits and the risks are. So we really are asking that folks contact their state senator to also state that we do not agree with this. And if doctors or any other medication this has to happen, why is marijuana any different? If we're going to treat it as medicine, then we need to treat it as medicine in every way, not giving people an out that don't feel comfortable with some parts of the law. Finally, there's also this issue of hubs. There was language put in about they're called hubs in the language. What they are is basically I had sent around a plan back, I think, in January about having money go to local communities, not going through all of these different levels of bureaucracy. Instead, going to local levels, every county would be delegated money, and basically this is kind of what the hub system has taken, was this general idea that every county would get a certain amount of money. It's $5 million over the biennium, so about $2.5 million a year would be given to counties, to every county, to basically coordinate efforts in those counties to make sure that all entities are working together. So the money would be given straight to the county commissioners instead of flowing through boards, instead of flowing through OMAS and all of those other things. Be given to county commissioners to help coordinate those efforts. It isn't opiate specific, which was kind of good, because as the opiate problem goes, then another thing will pop up. So we need constant public health model driven type of approach instead of focusing on the specific drug at hand. Prevention. Quite frankly, some of the pieces that they left out was prevention needs to be at the table. There's not a whole lot of direction given to what this coordinator would look like. This is a political appointee. Is this someone that has a treatment background, a prevention background? We don't know. There's no language given to that, so it's going to probably be left, if it stays in, it's going to be left into the hands of the county commissioner. You need to be contacting your county commissioner today to say, you know what, this language is in the budget bill. right now. We want to help you. We want to make sure that we are a resource to you. You don't necessarily need to be the ones in charge, as we all have a lot on our plates, but we at least need to be at the table so that good evidence-based prevention can be something that is taken into every county's plan and not forgotten about. Sometimes prevention is forgotten about because it's quite frankly, as I've been told, how do you stop something that hasn't started yet? So it's an interesting dance we have here, but prevention needs to be at the table. Contact your county commissioner today and say, you know what, we need to be part of those conversations. Again, you don't need to be in charge, but at least be at the table. This is, and we also need to work again with our state legislators, our state senators, to make sure that this is kept in the budget, this money is kept in, especially in light that we don't know what's going to happen with the federal budget. We don't know, the ONDCP, if this is what they think of community groups, I think we also have to, have a little bit of concern over what's going to happen to SAMHSA. We have to think about, what is going to happen to the CSAP grants, CSAT. And all of those types of grants, as we're looking, they're focusing more on stopping the flow of drugs into the country and basically destroying an infrastructure of community-driven support for these types of efforts. I worry about every program right now that deals with drugs and alcohol and prevention work. So this is money that needs to be kept in the state budget so that we can make up for it a little bit if something terrible happens in the state, or I'm sorry, in the federal budget. So finally, we have a marijuana update. So the applications are out for cultivators. We have Tier 1 and Tier 2 applications that are out there right now. Tier 1 applications are the bigger group, the bigger cultivators. They're I think 50,000 square feet or something at this point. The Tier 2 are the smaller cultivators. So the applications are out there. There are a couple of webinars that have been given about how to fill out the application. It's an interesting piece that the way they're doing it is that they have to hide. They're going to go with an independent group of folks who are going to be reading over these applications after they come in June 5th or June 5th or June 19th. They're going to go over these applications, and in any way, shape, or form, if you identify yourself, if there is a clue that you're trying to identify yourself, they automatically throw your application out. This is not cheap. I mean, this is quite an investment just to apply for these types of licenses in the state of Ohio. So June 5th through the 16th, the applications will be due for level 2. So June 16th is the last day that you can have level 2 cultivator application submitted, and June 30th is the last day that you can have a level 1 cultivator license application submitted. The cultivators will be notified. Those who actually get licenses will be notified in September, and then they have to give their $200,000 payment for level 1 and their payment for level 2. Level 1 cultivators cannot be level 2 cultivators, so you can't have more than one entity own more than one cultivation site either, and they cannot cross over either. So level 2s cannot own level 1s, all of that. There was a bill on the federal level that was introduced by Congressman Garrett from Virginia to basically decriminalize marijuana, take it off the scheduled list, and make it a lot like tobacco and alcohol. We are fighting that at the federal level. Also, there's something called the Rohrbacher Amendment that was added to the federal budget bill as well. That basically, what it does is it eliminates all funding for fighting marijuana laws in states that have legalized for medical or recreational purposes. So in Ohio's case, we would be considered a medical marijuana state. Any kind of money that we would fight or that we would use to fight, even illegal activity on the marijuana front would be taken away from the feds. It's a pretty dangerous amendment. It's from this Congressman Rohrbacher, who's a Republican senator out in California, and then backed by Jared Polis, who is also he's a Democrat from Colorado. These two folks have decided that they want to make sure that state marijuana industries are protected from federal input or law enforcement. So this is what's going on at the state and federal level. My advice would be immediately to contact your federal legislator about DFC. I really can't stress enough how dangerous this is. I know that a lot of groups signed a letter. A letter was sent yesterday to the OMB chairperson about this to try to avoid this situation. A number of press outlets have blasted the Trump administration for planning this in the midst of an opiate crisis, and I think we need to have our voice involved in that too. Also contact your state legislator on the budget issue. We do not need alcoholic ice cream. If they want to debate it, God bless them, and let's debate this thing. The weed doc issue, and also local money. Also can thank them for local money going straight to communities through the hub system that they're talking about, but also get on the phone with your county commissioner, hint, hint, so that you can be part of the conversation if and when this thing passes. It has to be passed by June 30th, or actually it has to be signed by June 30th. So testimony will begin this week on the opiate epidemic in the Senate. It's a great time to contact your senator, let him or her know what you think about the current budget proposal. I didn't know if there were any questions or anything, but we do have an announcement. Excellent.
Thank you, Tony, very much. Ladies and gentlemen, if you do have any passing questions, I've received a few that are best followed up with individually, and we will do that today, I assure you. Wanted to just make a quick reminder about National Prevention Week next week. In addition to the fact that both the Statewide Prevention Coalition Association will be meeting on Tuesday, May 16th, the theme for that day is a community message for prevention. There'll be a couple of exciting things that day. As SPCA members or members of community coalitions that belong to the network that Drug Free Action Alliance is so privileged to support, we will be discussing that day opportunities for community investment next year, ways in which we're going to support local advocacy on an individual level as well as throughout the larger coalition body. So we hope that if you haven't registered, you'll go ahead and you'll do that so you can be there and be privy to some of the announcements for what's coming next year and hear from some of the look back and the celebration of what coalitions have been achieving. I think of any time in our history in Ohio, now is a really good time to celebrate the work of coalitions, to make sure that people know what that work is, what it looks like, and why it's so important to protect. We're certainly trying to do that at the state level, and we want to make sure to support and honor what folks are doing at a local level. In addition to that, there will also be the Ohio College Initiative annual meeting. I know many of you have campus communities that you work with or partner with. That will also be taking place during National Prevention Week. We'll be quite active on social media as well. So for folks that are looking to highlight their community work, please make sure you use the National Prevention Week hashtags, the push for prevention. We really want to be able to just push out and distribute the messages, the photos, the activities, the accomplishments that are going on the ground level. So let us put you in pictures. So make sure that you use those hashtags, include us, make us aware, let us celebrate you. thank you so much for your time with us today. Thank you very much, Tony, for providing the federal and state insight for us. We will see you again in a month, and hopefully we'll see a few of you next week at some of the events. Have a wonderful day, everyone.